Hey, hi, I'm Dr. Steve Center. My practice is Body Logic MD of San Diego. I was asked to speak about testosterone pellet implantation. I've been doing that now for 3 years. We've done about 1,500 patients with a really high success rate. At least 90% of patients continue coming back for this again and again. Pellets began in the 1940s and were FDA approved about somewhere in the early 1970s and have been used by physicians all over the world. But they really became popular in the late 90s and early 2000s and now being done by doctors all over the world. The appealing thing about testosterone pellet implantation is that it's a one-time procedure which lasts typically 4 months for women and about 5 months for men. Obviously the time varies depending upon how the testosterone is metabolized. So the convenience is terrific. The procedure has only minimal discomfort. We've gotten so good at it, patients really have no pain and there's no downtime. People go right back to work immediately. We just ask them not to exercise heavily for about 48 to 72 hours. I put a waterproof dressing on the patients afterwards. The incision we make for implantation of pellets is about 3 millimeters. So there's really no problems with the stitching. The patients don't have to come back again for follow-up. They just leave a steri strip on for a week or two and they fall off. A few things about the pellets make them really interesting for me, and for me more appealing than doing testosterone creams or doing injections. One thing is that studies show that testosterone is released by the gonads in men or by the ovaries in women in a pulsatile fashion, meaning levels fluctuate up and down as much as 15 times an hour. And this has been documented by doing salivary testing every 15 minutes on patients. The problem with the creams and the injections is that the levels will remain the same all day. 24 hours a day the levels are going to be elevated, which is not a natural process, because it's natural for the levels to go up and down. So patients who receive creams or injections have a higher incidence of adverse reactions. These can include acne, hair growth in the upper lip, aggressiveness, and other symptoms. These aren't serious symptoms, but they are annoying for some, especially for some women. The pellets have a lower incidence of adverse reactions because the pellets release testosterone also in a pulsatile fashion. There were 2 studies done on patients by an Ohio surgeon, which showed that the levels seem to fluctuate the same way they do in patients who have normal testosterone production by their sex organs. And this means that when the patient needs testosterone, the capillaries around the site of implantation will dilate to let more testosterone into the body, and then when the activity finishes or you go to sleep, the levels will drop back down to baseline again. So because the levels are going up and down, we don't see that constant high level. It is unnatural, and patients do really well. Also, I've done the creams myself and the injections myself, and I did get some benefits from it, but I found the pellets to be more dramatic. I think it's because there was that surge of testosterone when you're doing physical activity that you get when you're getting the pellets. You don't get with the shots or with the creams. You don't get that fluctuation. They're just high all the time. So that's one reason why I've been really pleased. There was a 12 or 13-year study done on 220 patients using testosterone pellets, and it showed that 87% of patients after a single implantation came back again to repeat it. After the third implantation, 97% of patients continued for the duration of the 12-year study. So nothing beats results like that, and that really impressed me. They also found that with pellets, there was no real increase in blood clots or any other adverse reactions. These were studies done on women as well, because that's been a concern of some doctors that testosterone could cause thrombosis. It doesn't. It does not have that effect. There have also been a few studies done showing very promising results in patients who have breast cancer. And I do see patients occasionally with breast cancer. And some studies have been done showing that testosterone pellets will inhibit metastases and recurrence of breast cancer. So obviously this is not a common occurrence where I see patients who have cancer or who've had cancer, but knowing that there are potential protective effects, when I give it to a woman who's concerned about future breast cancer risks, I give it with full knowledge that I may actually be reducing risks rather than increasing them. Testosterone given by pellets has not been shown to increase estrogen levels. In the 3 years I've been monitoring patients with pellets, I very, very rarely will see estrogen levels go up. It never happens in women. Occasionally it'll go up in men who are obese, because men who are obese already make a lot of estrogen to begin with, but the incidence is very, very uncommon. Still, Pellets should be done by a physician trained in anti-aging and integrative medicine to know how to monitor for safety. We do our lab testing about 2 months after implantation. We check our levels and we see if patients mid-therapeutic range. If they are, then we'll continue the same dosage. If the levels are a little bit low, we'll raise the dosage up, and if the levels are a little bit elevated, we'll drop them back down again. We're trained to start at a low dose and gradually work upwards. So it depends upon the physician what their starting doses are. I have ones that work well for my practice, but generally it's very unlikely that I would have to actually drop the dosage back down again. So to reiterate, the success rate of pellets has been extremely high. Patients really like this procedure. I've had it done 6 times. I'll do it the rest of my life. I don't plan on ever stopping. And it's become a very important part of my practice. Okay, so we're marking a spot here halfway between the iliac crest and the gluteal crease. The pellets are going to go in the soft tissue here. I think we're going to do, you don't have a lot of fat up here. I think we're going to do this a little more medially. It'll be good. Okay. And we're going to be, this is your, how many implantations have we done on you now?
This will be your third.
Okay. So pellet implantation has been done since the 40s. It was FDA approved about 40 years ago. And this technique, the concept behind testosterone pellet implantation is that the bioavailability of pellets is 100% because it's placed into the body. Also, when the pellets are placed, they release in a way that mimics the gonadal release of testosterone, meaning we see fluctuations occurring during the day to match the body's demands. And that makes pellets inherently the safest form of hormone administration because we're not creating a high level constantly. Testosterone injections and creams cause a high level in the blood all day, which creates a greater likelihood of converting into estrogen and into DHT. These are both metabolites of testosterone that are, not that they're undesirable, but when levels get too high, adverse reactions can occur. So with pellets, we see much less of this conversion, and patients experience great benefits, but adverse reactions are very uncommon. Water retention. Okay, so we're prepping the skin now, and we're going to numb the epidermis, and then we're going to numb the fat. So the pellets each are about 100 milligrams. We're going to, how many are we doing today with him, Carmen?
14.
1,400. Okay. So first we're going to numb the epidermis, and we're going to numb the fat, and then we're going to make a tiny 3mm incision. Pellets can be implanted in like a chevron pattern in the fat underneath the skin, about ½ inch to 1 inch deep. And the pellets will begin to melt fairly soon and reach therapeutic levels in about 10 days. And then they will get a duration. Typical duration is about 5 months. Some men go longer, some need it done more frequently. And we test levels at about 8 weeks to make sure that they're where we need to be. Some patients will do a before and after measurement. I mean, we'll do like a 2-month and a 4.5-month measurement to see what the peak and valley is, the high level and the low level, and adjust our dosage on that. Okay, so I've already done the prep. We're going to put a drape over you. Okay. So first we're going to get the epidermis. This part stings a tiny bit, little tiny poke. And that shouldn't be too bad, just a little burning sensation. Okay, so that's the epidermis. Okay, now we're going to do the deeper injection, which goes right into the fat. And I know I'm in the fat because the needle moves easily. So I'm going to put about 4 cc's in there. And then another 4 cc's about halfway through across there. I'm going to tap your skin. Now tell me if you feel anything on the surface there. Dull?
No.
Good. All right, we're going to make a little incision. Tell me if you feel anything. Nothing?
Nothing.
Good. There's our little incision. I'm working across my body here with a little tight space. trocar with a spike on it. We're going to snake this straight across here into the fat. Tell me if you have any discomfort as I do this.
Okay.
There it is. So that's now under the skin. I'm going to start placing the pellets in the little groove. I'm good, Carmen. Two. You got some tape for me?
Yes,
Mm,
it's to the left of the table,
Thank you.
to your side.
Thank you. That's 400 milligrams. There's the first 4. I'm going to move that down a little bit there, create another track. One, 2, 3, 7. Now I'm going to create a new track so we don't have all the pellets bunched up against each other. This one I'm going to go a little more toward the top. You've got tough fat. I think we commented about that with you before. There it goes. There it is. But so. 3. So 4, 4, 3, 3. That's 1,400. Okay, there it is. And they're all done. Okay, so that's the whole procedure. I'm going to clean off the betadine, then we're going to put some steri strips on the skin. So the pellets, normally our normal lab retest is about 8 weeks. And then based upon that level, we make an adjustment on the next dosing. But as I say, some patients will test them again at 4.5 months to get a trough level, and that's helpful. Okay. So we're going to make this a real simple little dressing. Notice there's minimal amount of bleeding. That's first steri strip. 2. And make like a little X. And as Dr. Glazer taught me, we take a little small 4x4, fold it into sixths. This goes right over the incision, puts all pressure on it. And we use a Band-Aid right over the middle. Great. And now some tape, just to kind of make this waterproof. With a waterproof dressing, usually patients can get it wet the next morning in a shower, there's no problems. And then we ask you to leave the Band-Aid on for about 2 to 3 days, and then take it off. We also ask that you refrain from any heavy exercise for about 72 hours or so. That should stay in place. Ice pack. This is going to go, your pants are going to kind of go on top of this so your hands don't freeze. And you can go ahead and put your hand right where the belt is, probably is the best spot, right there. And hold that for about 10 minutes. And that should do it.
Okay.